So this skills is feeding patient who cannot feed self, credentia way. So what are the supply? I need to have my bib or cloth protector, they call it. I have my 2 wipes. Wipes is to wipe their hands for infection control, okay? So candidate already sitting in a wheelchair. On your regional exam, it varies. Some sitting on the edge of the bed, some sitting in a wheelchair. It's the same practice, same technique, okay? So what else do we need? I think that's it. So, and then of course, a chair to make sure you sit facing the patient. First, I'm gonna wash my hands. I have my meal tray already here. I'm gonna knock on the door. Mrs. Hollis, can I come in?
Yes, come in.
Hi, my name is Rusty. Good morning. I'm your nursing assistant today. Today, I'm going to help you with feeding or eating your breakfast. Would that be okay?
Yes, okay.
Patients say yes. Check the name badge. Close the curtain for privacy. Wheelchair lock for safety. And then after that, go ahead and put the tray in front of your patient. That's what the book says. Make sure you get your chair as well. You sit after you set up your paciente or your patient, okay? So, Mrs. Solis, I'm gonna put your cloth protector. Here you go. Thank you. Now you can sit. So, your book says you have to wipe the patient's hands. Mrs. Solis, give me your hands for me. Here you go. Same thing with the other side. Do this. So, here you go. And then go ahead and throw this on a garbage can. Okay. And of course, I already washed my hands as well. Now we're all set. So your book says you have to check the patient's name and the patient's candidate name. Let me see. Are you Mrs. Solis?
Yes.
Correct. Very good. Now go ahead. I have all the food here. I have my sandwich, my grapes, all these fruits, vegetables, you name it. Milk, orange juice, apple juice, you name it. Okay. So which one you want to eat first, Mrs. Solis? You want to eat this?
Yes.
Very good. I'm going to cut it for you. One bite. Here you go. Okay. And then observe the patient for any difficulty swallowing or any issues, okay? After that, swallow, offer a meal. How are you? You okay?
Fine.
Okay, good. Here you go. Swallow, and then followed by liquid. Are you done, Mrs.
Yes,
Solis? Okay, patient's full. Very good. So, okay. And then go ahead and wipe the patient's hands again, even though the patient did not touch their hands. The book says you have to wipe before and after. So this goes to the garbage can, of course. And then go ahead and remove your table. So this one here, you need to remove. Okay, and then make sure you offer the patient to wipe their mouth. Okay, here you go. So usually when you have the bib, just use that or use the towel. So to ask the patient to wipe their mouth for encourage independence as well. Okay, so after that, go ahead and remove this. Check how much the patient consumed. So again, this goes to the hamper, of course. Go ahead and wash your hands. Here's your call, like call me if you need me, okay?
Thank you.
Very good. And then you report and then you record.